Good evening, good morning, wherever you are in the world. My name is Dr. Pukam Kelly Bunkua, and I've been sort of struggling how to bring this video to fruition to what are things that are people experiencing, right? You know, I'm in the Seattle, Washington state area, the first state where we've had the first case of death with COVID-19. And so we've been experiencing a lot of shelter at home for a while now, and the school closures and not being able to work and finding new ways to sort of work or be with our loved ones and our friends, and how to experience social distance in a way that is about more physical distance recommendation than social, meaning that we have to learn a new way to express how we care about one another. That takes a lot of our creativity, our flexibility, but we are very capable. Our human history tells us so. There's been so many pandemics and wars and conflicts in our human history, but our DNA is very resilient, and what you're doing right now is building that resilience to deal with anything or any kind of thing that comes your way. And so I just want to remember that my experience working with kids as young as 4 or 5 to adults as 68 years old. I work with children, families, and couples. And what I'm seeing is that we all experience stress and dealing with this epidemic or pandemic, COVID-19, very differently, because it affects us differently. And if we have history of anxiety or depression or family conflict or struggles in our relationships before all this happened, we're still going to have to deal with that. Some may be worsened by the fact that we're all have to be homebound and there's no place to go because we're trying to keep everybody safe by staying at home. Imagine, sometimes when we have had family holidays, how hard that was sometimes in family relationships. Now we're worried about our elders and our senior citizens and the vulnerable population. And at this age, they're also very vulnerable to depression. So we need to make sure we check on them to see what they need. And when there's social isolation, we tend to get more depressed, more anxious. Because part of our human DNA in our brain is to protect us. And when the brain perceives there's a threat, and yes, it is a threat right now, and it's scary. But what happens is when the brain perceives instant threat, and we see people panicking by buying things and by hoarding things, we also think that there must be danger. So we must do the same. We must get all the supplies to protect ourselves and our family. So some people have experienced fear to the point where their anxiety, if they had a history of anxiety, their panic attacks have been worsened to the point where it elicits sort of this illness and feeling like you have the symptoms of COVID-19, the shortness of breath, and then you cough because you can't breathe, and you panic, and then your immune system wears down, because our mental health is 75% of our psychosocial stressors, the things that we go to our primary care providers for, because we tend to get stressed, and then we get worn down, and we get sick. Things that could have been a common cold, we feel, or the seasonal allergies right now, now it's making our anxiety worse, like maybe I have it. So we're panicking. Also, a lot of us are not sure what our jobs are gonna be. What's the status of our financial situation? Healthcare. Are there enough masks? Are there enough medicine for us? Is there enough ventilators? All those things are very legitimately worrisome. But I want you to share something that it's a unique time that we're all sharing this at the very same time. But there's also a moment to pause about and reflect about our world, how we take care of our world, how we take care of our family, our priorities, the job, our health. So we're getting an opportunity to use this and also sort of rise to the occasion for us to support one another as humans, as one family, and also the differences in how we respond may be different. Some of us may behave in ways that maybe, we didn't expect people to behave, because with fear, there's also irrationality. Some of our children might display different behaviors than they normally do. Might be more clingy, might be more sad, might be more irritable. Maybe some of us can't sleep at night because our body's restless thinking about it. We're picking up each other's fear and anxiety, and we're all kind of doing the best we can. I'm going to tell you, I've talked to my psychologist colleagues, and I see other doctors in other fields and healthcare providers. We're all experiencing the same fear and anxiety, but some of us are still in the front line, or some of us are still seeing clients. And psychotherapists like me, we're doing telehealth. We're trying to find ways to still provide healthcare, but yet we also are human. We're experiencing the same concerns that you are, and maybe that's why I've sort of hesitated to sort of put this video of what I see in our community, what I see in the clients that I see. The one thing I do want to mention is that the clients that I do see, I've noticed that they have a resiliency because of our work together. They build up the ability to sort of express themselves, what's going on, and how to cope during this time. Also, I heard parents and worried about how to sort of homeschool their kids. And the thing that I've also noticed is that people like me, we're still working. So even in the doctor's homes, we were struggling to homeschool our children because we never sort of volunteered to homeschool. That's why they went to school. And so, I think it's important that we continue to teach them that we love them, that they are safe, that we are in it together, and to make this time about love, about how to be together as a family. They're learning every day how you deal with stress. They are learning every day how to prepare a meal, how to help out around the house, how to engage, how to play a game, and how to value family time. That to me is one of the best things you can teach your children. Yes, when we feel safe in our brain, in our body, in our mind, we can do well at school. We can do well in anything that we set our mind to. But until we feel safe there and how to sort of cope together, it's really going to be hard to study. So one of the most important things that I would want to encourage you to do is to really be kind to yourself and allow whatever feeling that you have to just name it. If it's fear, fear. And it's okay to feel fear because there is a threat. We are worried about ourselves, our family, our world, our livelihood. So it is something to worry about. But look at the things that you can control in your own life, such as if you're able to work from home, work from home. Great opportunity to see how that works, right? Maybe there's an opportunity for your jobs and your employers to see that there's possibilities that this job can be done in different ways. So there's an opportunity to grow here, and I see that there's more gratitude in the things that we have, especially in the US, as far as the resources to be able to stay home. It's hard for me to imagine that people in my ancestral homeland of Laos and in Thailand, the people that have to still make a living and can't stay home. And so all over the world, we're sort of dealing with this in our own way the best we can. But like I said earlier, we are human that have been resilient, and our DNA has shown us that we have, and we have come together and helped each other in times of struggle. So if you do find yourself that it's affecting you, that you can't sleep, you can't eat, or you can't concentrate, or you are resorting to coping strategies that are not healthy, like using substance abuse or drinking, or it's affecting your relationships, because when situations like this happen, domestic violence can increase. Irritability. I've seen, sometimes with men who want to protect us may get angry easier about and being short about things. And I'm not just saying that with men, but there's also different behaviors that maybe we do as women that wanting to protect, be the mama bear, that we may be a little bit more protective, or there's things that whatever arises to sort of give yourself that break. And I hope that you're kind in your comments, because it is really my intention and effort to bring awareness to our shared experience. from a professional perspective. And the other thing is that there's a lot of Asian American healthcare providers out there. They're on the front line, they're in the hospitals, they're doing so many different roles. We're one of the second largest ethnic group to play a role in healthcare. So while they're working in the healthcare field to save lives, to sort of comfort those that are struggling right now, please be kind to their families that might be supporting them, that might be getting the groceries for them, that might be, you know, making sure that when they come home, things are clean. So when you see Asian Americans out there, they're just afraid just as you are. So we are in it together. And I just want you to all know that we all want our families to do well, to be safe, and to be loved, and to be accepted. So we share that as common human beings. So I wish you all well. And if you have questions that I didn't answer, please put it on the comment, and I'll try my best to comment from my experience, from what I'm noticing in the world, and from a psychological perspective. Like I said, I'm also human, and it took a while for me to think about how to do this. And there's no script. It's just coming from the heart of what I've experienced, what I've noticed. So one of the things is maybe before you post, before you comment, think about how would my comment affect someone? Because something that we could sort of deal with at that moment, we no longer have the patience to deal with any negativity or any political or anything. If we can't share love, maybe just stop. Sometimes silent from your social media comment or anything else is the best way you can support someone. Is not to say anything. Going back to our kindergarten rules, to wash our hands, to make sure that we are in our bubble space and not invade somebody else's bubble space, to make sure that they're safe, and to be kind. Those are the 3 rules we learned when we were 4 or 5 years old. So just remember, be kind, be loving, and be safe.